Jamie. We miss Jamie as well. Jamie, please go ahead and ask your question. One question.
Can you hear me, Tarek?
Yes, please go ahead.
Okay, great. Hi, this is Jamie from Associated Press. We're wondering why might the death rates across Europe be so variable? Italy's death rate is at about 11%, and they will soon overtake Hubei province in terms of numbers of deaths, while other countries like Germany, France, Spain, and the UK have reported far lower death rates, closer to 1 to 2%. What might explain that discrepancy? Thanks.
Hi, Jamie. Yeah, I almost miss you as well. It's a good question, and there are a number of factors that might explain that. But certainly, one of them is testing. If you look at Germany, and we had some very good communication with Germany today. They've had a very aggressive testing process. They've tested and confirmed over 6,000 cases with just 13 deaths, but that may reflect the fact that they're really aggressive in their testing strategy. So the number of tests and the number of confirmed cases may be detecting more mild cases as a proportion of all cases. That's an important determination. The second issue is the evolution, or the time of evolution in the outbreak. What we do see is a pattern of long hospital admission. So Italy, having experienced the first wave of major transmission much earlier than other European countries, is now experiencing those deaths because a lot of people reach a point where they can no longer be saved in the clinical system. So therefore, the deaths occur sometimes 2 to 3 to 4 weeks after the infection starts. So again, you have to look at where each country is in the epidemic cycle. The other factor may be to do with the age profile of populations. For example, Italy has a much older age profile and has a higher proportion of people in the very elderly category. And in some ways, Italy has been a poster child for healthy people living into old age. And we've always asked ourselves the question, why Italians and people living on the Mediterranean are healthier and live longer lives. But unfortunately, in this case, having that older population may mean that the fatality rate appears higher because of the actual age distribution of the population underneath. There may be technical reasons as well in terms of the ability to provide standard of care. We saw this in China. We saw this in Hubei. When you looked at the case fatalities inside Hubei and outside Hubei, there were significant differences in case fatality. And anyone who's ever worked in the front line of an emergency, when patient numbers begin to overwhelm, it becomes a simple factor of your ability to provide adequate care and react to every change in the patient's condition in an intensive care environment. So I think there are circumstances in which the standard of care cannot be maintained when patients are being overwhelmed. And I point you to the tremendously courageous and brave physicians, nurses and intensivists in Italy who haven't been dealing with 1 or 2 patients in intensive care. But for example, in northern Italy, over 1,200 patients in intensive care at the same time. It's an astonishing number. The fact that they're saving so many is a miracle in itself. So I think there are many factors, Jamie, and they all play into the actual numbers. And Maria may offer more technical advice on that.
The only thing to add is exactly where the virus is circulating in each country. And so you have to look at the demographics of where it is circulating. In Korea, we had these clusters, these very large clusters related to a church, and the age distribution of those cases were much younger than what we're seeing in northern Italy, for example. You may see outbreaks in long-term care facilities where the age is much higher. And so it's important where those clusters are occurring and where you're capturing your cases from. But we do need to be very careful when we look at mortality rates and we compare mortality rates. It's not right to compare them yet. What we need to do is find out why we're seeing differences and what that actually means in terms of our understanding of this virus and how it impacts different populations. We've said previously that we need to be very careful when we compare a calculation of the number of deaths over the number of cases that are reported per country. And Mike has outlined the reasons why that is difficult. But we have not seen the way this virus will behave in other vulnerable populations. We have not seen how this virus will behave if and when we see in vulnerable populations of high prevalence of HIV, for example, or malnutrition children, for example. And that's what we need to prepare for. So every death is significant regardless of where this takes place. And we need to ensure that all of the measures that we take are preventing transmission, because every step that we take there will prevent death.
Supplement here on the issue of severity. If you look at the case series that have been produced and published from Korea, almost 20% of their deaths have occurred in people under 60. So the idea that this is purely a disease that causes death in older people, we need to be very, very careful with. And physicians again in Italy will attest to this, and in Korea. This isn't just a disease of the elderly. There is no question that younger, healthier people experience a much overall less severe disease, but a significant number of otherwise healthy adults can develop a more severe form of the disease. And that's why we need to be ever vigilant in ensuring that we observe everyone, even the mild cases, for any signs of clinical progression to a more serious disease.
Thank you very much. Shall we go